Vital signs prepared by Musa Abdel Fattah Musa, Assistant Lecturer, Pediatric Department, Faculty of Nursing, Cairo University. Purposes is to assess general hemodynamic status of the child within the first hours of admission to an acute care setting, assess baseline data, measure the response to treatment regimes, assist in diagnosis or differential diagnosis of certain disease. Special considerations. Vital signs should be measured as sequence respiration, then pulse, and finally temperature. Auscultation is the preferred method of measuring blood pressure in younger children, while automated devices are acceptable when auscultation is difficult or when frequent measurements are required. Don't routinely measure blood pressure in children. Don't measure blood pressure from extremity with altered circulation, wound, injury, or foreign devices, such as renal dialysis shunt. Count heart rate, respiratory rate on full minute. Epical pulse should be measured for children younger than 2 years. Bain assessment is considered as the fifth vital signs. Vital signs should be measured while the child is calm, quiet, and in comfortable position. Respiration. Definition. The function of respiratory system is to supply the body with oxygen and remove carbon dioxide through the diffusion of gases between the air in the alveoli of the lungs and the blood in the alveolar capillaries. Normal respiratory rate for different age groups. Age less than 1 year, 30 to 58 breaths per minute. 1 year to 3 years, 22 to 37 breaths per minute. 4 to 5 years, 20 to 28 breaths per minute. 6 to 12 years, 18 to 25 breaths per minute. 13 to 18 years, 12 to 20 breaths per minute. Pulse. Definition. The pulse is a pressure wave of blood caused by alternating expansion and recoil of elastic arteries during each cardiac cycle. Normal heart rates for children at different ages. Newborn heart rate range 100 to 170. Average heart rate 120. Infants to 2 years heart rate range 80 to 130. Average heart rate 110. 2 to 6 years heart rate range 70 to 120. Average heart rate 100. Age 6 to 10 years heart rate range 70 to 110. Average heart rate 90. 10 to 16 years heart rate range 60 to 100. Average heart rate 85. Temperature. Body temperature is a regulated function of the hypothalamus and is the balance between heat gain, metabolism, and heat loss, respiration. Heat loss depending on various conditions such as gender, recent activity, food, and fluid consumption and illness. Heat is gained through metabolic activity of the body, especially of the muscle and liver, and heat loss is achieved through the skin by the process of radiation, convection, conduction, and evaporation. Core temperature, also called core body temperature, is the operating temperature of an organism, specifically in deep structure of the body, such as the liver, in comparison to temperatures of peripheral tissues. Core body temperature ranges between 36.4 to 37.4. Methods of measuring body temperature in infants and children. Rectal method. Method range 37 to 37.8. Length of time 3 minutes. Age newborn. Advantages of rectal method. save for newborn who are unable to cooperate and may bite the thermometer, not directly influenced by the ingestion of hot or cold fluids. Method of choice: if a child has seizure or breathing difficulties, receiving oxygen therapy, or has oral surgery. Disadvantages of rectal methods: values may be altered by presence of stool, optional response may be negative, damage to rectal mucosa, replication of thermometer placement is difficult, contraindicated when child has diarrhea and following rectal surgery. Rectal method: rectal temperature shouldn't be used in children who having rectal surgery or receiving chemotherapy. Procedure should be done by rectal thermometer. Measuring rectal temperature is generally unnecessary because of the risk of rectal perforation and sexual abuse. This is a cross section of the rectum that illustrates curve at approximately 2.5 to 3 cm from anus, where risk of perforation from thermometer is greatest in infants up to 3 months of age. Oral method: range 36.4 to 37.4, length of time 5 minutes, age more than 6 years children. Advantages of oral method: easily accessible, replication of thermometer placement is easy, response more quickly and regular to changes in arterial temperature than does rectal method, more aesthetically pleasing. Disadvantages of oral method: value is really influenced by ingestion of hot or cold fluids, and oxygen therapy requires child's cooperation to keep mouth closed and not to be by the thermometer, contraindicated if the child has oral injuries, surgery, or under the age of 5 years. Axillary method: range 35.8 to 36.6, length of time 10 minutes, age less than 6 years children. Advantages of axillary method: safe and easily accessible, avoids the danger of rectal or colon perforation, avoids initiating the defecation stimulus, often recommended for infants. Disadvantages of axillary method: value is more readily influenced by environmental temperature and airflow, requires a relatively long period of time to obtain accurate reading. Different types of thermometer: mercury, digital, thermometer nipple type, tympanic membrane. Number 5, temporal artery temperature. Blood pressure. Blood pressure is the force exerted by circulating blood on the walls of the blood vessels, arteries and veins during each heartbeat. Blood pressure varies between a maximum systolic and minimum diastolic pressure. Systolic pressure, the peak pressure in the arteries during contraction phase of cardiac cycle, can be measured as the point when sound can first be heard during deflation of the pressure cuff. Diastolic pressure, the lowest pressure, can be measured at resting phase of cardiac cycle. Remember too, blood pressure measurement is a part of a routine vital signs. Blood pressure should be measured annually in children 3 years of age through adolescence and in children with symptoms of hypertension. The cuff should have sufficient length to accompany encircle circumference of limb, have sufficient width to cover approximately 75% of the limb based on a midpoint limb circumference. Child stage: newborn, arm circumference 5 to 7.5, cuff size 3, length 5. Child stage: infant, arm circumference 7.5 to 13, cuff size 5. Length 8. Child stage, child, arm circumference 13 to 20, cuff size 8, length 13. Formulas of approximate average systolic pressure in relation to child's age. Child's age 1 to 7 years. Formula age in year plus 90. From 8 to 18 years, 2 multiply age in years plus 83. Formula of approximate average diastolic pressure in relation to child's age. Child's age from 1 to 5 years, 56 millimercury. From 6 to 18 years, age in years plus 52. Look at for this figure that shows sites for measuring blood pressure. A. Upper arm, B. Lower arm, C. Thigh, D. Calf or ankle. Guidelines for determining blood pressure. Limb size and cuff selection must accommodate the circumference. Excessive pressure on the antecubital fossa affects on the sound. Children easily become anxious, which can elevate the blood pressure. Blood pressure values change with age and growth. The child should be quiet and relaxed during performance of this procedure. Blood pressure is measured before any anxiety procedure are performed. Record limb position, cuff size, and measurement systolic value and diastolic pressure. Bain assessment. Definition of Bain. Bain is an unpleasant sensory and emotional experience associated with actual and potential tissue damage. Bain is often referred to as the fifth vital sign, and it should be assessed and recorded as often as other vital signs. Assessment of Bain should include level of intensity, location, frequency, duration, aggravating and relieving factors. Frequency of assessment. Assessment should be performed hourly if a child is receiving an analgesia infusion, a regional or an epidural infusion. At least hourly immediately after surgery, decreasing in frequency as observations decrease. If a child complains of pain following administration of analgesia, when a procedure is carried out that would normally cause pain or discomfort, at least once a shift for all children to early detect if they have any pain. Pain assessment scales for children. Visual analog scale. Self-reporting using the visual analog scale is the gold standard and is the most validated tool. The vertical version is more suitable for children from 3 to 7 years. Number 2. Numerical rating scale. The child must know how to count and be able to transcribe the intensity of the pain in numbers to use this scale. This scale is suitable for children more than 6 years. Number 3. Phases pain scale. This scale represents phases in 5 levels of pain. The absence of standardized representation of painful facial expression is a limit. The phases can represent feelings such as joy, sadness, or anger, and not just pain. Number 4. Verbal rating scale. This scale contains a list of adjectives describing different levels of pain intensity, rated on a 6-point scale: 0 no pain, 1 mild pain, 2 moderate pain, 3 severe pain, 4 very severe pain, 5 worst possible pain. The scales were recently developed for children older than age 8 years.
Hello, today we're talking about vital signs. Purposes is to assess general hemodynamic status of the child within the first hour of admission to be an acute care setting. Assess baseline data, measure the response to treatment regimens, assist in diagnosis or differential diagnosis of certain disease. Special consideration, vital signs should be measured as sequence, respiration, then pulse, and finally temperature. Auscultation is the preferred method of measuring blood pressure in young children, while automated devices are acceptable when auscultation is difficult or when frequent measurements are required. Don't routinely measure blood pressure in children. Don't measure blood pressure from extremities with altered circulation, wound, injury, or foreign devices such as renal dialysis shunt. Count heart rate or respiratory rate on full minute. Epical pulse should be measured for children younger than 2 years. Bain assessment is considered as the fifth vital signs. Vital signs should be measured while the child is calm, quiet, and in comfortable position. First, respiration. Definition: the function of respiratory system is to supply the blood with oxygen and remove carbon dioxide through the diffusion of gases between the air in the alveoli of the lung and the blood in the alveolar capillaries.
Watch with a second hand or digital readout steps. Number 1, wash hand to reduce transmission of infection. Number 2, prepare all needed equipment to save time and effort. Number 3, review the child's previous respiratory rate when available to provide basis from which to make comparison. Number 4, note the child's medical diagnosis and history or respiratory problems or difficulties. 2, alerts to potential respiratory problems. Number 5, determine whether the child is taking any medications that may affect respiratory rate or depth. Medication can alter respiratory pattern, like morphine can decrease the respiratory rate. Number 6, wash hand to reduce transmission of infection. Number 7, count respiration when the child is awake and calm or when asleep. Number 8, observe the abdomen for movement in infants and young children, or observe thoracic movement in older children. Number 9, count the number of respirations for 1 full minute to ensure accurate measurement. Number 10, note depth and pattern of respirations, presence of anxiety, restlessness, and irritability, altered to respiratory distress and signs of hypoxia. Number 11, record the results immediately. Make findings available to other healthcare members. Number 12, wash hands to reduce transmission of infection. Number 13, report for any abnormalities for early detection and intervention.
Look at your procedure book for table for normal respiratory rate for different age group. Number 2, pulse. Definition: the pulse is a pressure wave of blood caused by alternating expansion and recoil of elastic arteries during each cardiac cycle.
Equipment: watch with a second hand or digital readout, stethoscope, antiseptic swab or cotton with alcohol, now look at your procedure book for sites of talking pulse, radial or brachial pulse. Steps. Number 1, review the child's previous heart rate when available. 2, provide basis from which to make comparison. Number 2, determine whether the child is taking any medications that may affect heart rate or depth. To obtain accurate reading. Number 3, obtain measurement when the child is quiet whenever possible, as stress can increase heart rate. Number 4, put the child in comfortable position. Uncomfortable position can increase pulse rate. Number 5, wash hand to avoid cross-infection. Number 6, place the 3 fingers along the appropriate artery and press gently, as the fingertips are sensitive to touch. Number 7, count for 1 minute, as sufficient time is required to detect irregularities or other defects. Number 8, record the pulse rate, rhythm, and strength. Number 9, clean and return equipment to safe storage. Number 10, wash hand to avoid cross-infection. Number 11, report for any abnormalities. Apical pulse. Steps. Number 1, review the child's previous heart rate when available to provide basis from which to make comparison. Number 2, determine whether the child is taking any medication that may affect heart rate or depth to obtain accurate reading. Number 3, repair all needed equipment to save time and effort. Number 4, wash hands to avoid cross-infection. Number 5, clean stethoscope chest piece with antiseptic swab before examination to reduce transmission of infection. Number 6, identify site, palpate the chest wall to determine the point of maximal impulse in between the 4th and 5th intercostal space. Sufficient time is required to detect irregularities or other defects. Number 7, place diaphragm of stethoscope on the apex of the heart in between 4th and 5th intercostal space, as these positions appropriate where heart sound are best heard at these ages. Number 8, count heartbeat peripherally when the child is awake and calm or when asleep. Number 9, count for 1 full minute, as counting a full minute gives more accurate rate. Number 10, record results immediately. Number 11, wash hands to avoid cross-infection. Number 12, report for any abnormalities. Look at your procedure book to see normal heart rates for children at different age.
Number 3, temperature. Body temperature is a regulated function of the hypothalamus and is the balance between heat gain and heat loss. Heat loss depending on various conditions, gender, recent activity, food and fluid consumption, and illness. Heat is gained through metabolic activity of the body, especially of the muscle and liver. And heat loss is achieved through the skin by the process of radiation, convection, conduction, evaporation. Core temperature, also called body temperature, is the operating temperature of an organism, especially in deep structure of the body, such as liver, in comparison to temperature of peripheral tissues. Core temperature ranges between 36.4 and 37.4.
Equipment, thermometer, cotton with alcohol, dry cotton, container for waste, water soluble lubricant, non-sterile gloves, water soluble jelly. Now look at your procedure book to see types of thermometer.
Methods of measuring body temperature in infant and children. First method, rectal method. Temperature range from 37 to 37.8. Advantages: safe for newborn who are unable to cooperate and may bite the thermometer. Not directly influenced by the ingestion of hot or cold fluids. Method of a choice: if a child has seizure or breathing difficulties, receiving oxygen therapy, or has oral surgery. Disadvantages: values may be altered by presence of stool. Optional response may be negative. Damage to rectal mucosa. Replication of thermometer placement is difficult. Contraindicated when child has diarrhea and following rectal surgery. Length of time 3 minutes. Age for newborn. Method number 2, oral. The temperature range from 36.4 to 37.4. Advantages: easily accessible. Replication of thermometer placement is easy. Response more quickly and regular to changes in arterial temperature than rectal does method. More aesthetically pleasing. Disadvantages: value is really influenced by ingestion of hot or cold fluids and oxygen therapy. Require child's cooperation to mouth closed and not to bite the thermometer. Contraindicated if a child has oral surgery. Or under the 5 years of age. Length of time for 5 minutes. Suitable age more than 6 years of children. The last one, axillary route from 35.8 to 36.6. Advantages: safe and easily accessible. Avoid the danger of rectal or colon perforation. Avoid initiating the defecation stimulus, often recommended for infant. Disadvantages: value is more readily influenced by environmental temperature and airflow. Require a relatively long period of time to obtain accurate reading. Length of time for full 10 minutes. Suitable age less than 6 years children.
Oral temperature. Steps. Number 1. Check that the child has not just had a cold or hot drink to provide accurate measurement. Number 2. Clean thermometer with alcohol swab to reduce transmission of infection. Number 3, check thermometer to see that the reading is down below 35 Celsius. Number 4, Place thermometer under the patient's tongue and ask him or her to close his lips without biting. As the highest oral temperature reading is at the posterior base of the tongue, which is least affected by environmental conditions. Number 5, keep thermometer there for 5 minutes. Number 6, remove the thermometer. Number 7, wet thermometer with dry cotton swabs. Number 8, read thermometer. Number 9, record the temperature. Number 10, clean the thermometer with soap and tap water. Number 11, dry it and keep in its container. Number 12, wash hands to reduce transmission of infection. Number 13, brace the child for cooperation. Rectal temperature, steps, hand washing to reduce transmission of infection, prepare all needed equipment, don gloves, clean thermometer with alcohol swab, to reduce transmission of infection. Check thermometer to see that reading is down below 35 Celsius. Apply lubricant to thermometer, as lubricant makes it easier to insert the thermometer. Grasp the infant's ankle primally, placing your index finger between the ankle bones to prevent skin trauma. Insert the thermometer bulb into the rectum from 1 to 1.3 for infants to 0.5 centimeter. Hold it there for 3 minutes. Remove the thermometer and wet it with dry cotton swab. Read the thermometer reading. Record the temperature. Close the child. Clean the thermometer with soap and tap water. Dry it and keep in its container. Wash hand. To reduce transmission of infection. Report any abnormalities.
Rectal temperature shouldn't be used in children who having rectal surgery or receiving chemotherapy. Procedure should be done by rectal thermometer. Measuring rectal temperature is generally unnecessary because of the risk of rectal perforation and sexual abuse. Look at your procedure book for a figure that shows cross-section of the rectum.
Axillary temperature. Steps. Wash hand to reduce transmission of infection. Prepare all needed equipment to save time and effort. Wash hand to reduce transmission of infection. Clean thermometer with alcohol swab to reduce transmission of infection. Check thermometer to see that reading is down to 35 Celsius. Clean under axilla with dry cotton. Place thermometer under axilla and bring arm across chest. The thermometer must be placed between the two dry surfaces of the axillary, ensuring no clothing touching the thermometer bulb. Leave in place in 10 minutes to ensure the thermometer in contact with skin surfaces. Remove the thermometer and wet it with dry cotton swabs. Read and record the temperature. Clean thermometer with soap and tap water. Dry it and keep in its container. Wash hand to reduce transmission of infection. Report any abnormalities.
Tympanic temperature. Tympanic thermometer senses reflected infrared emission from the tympanic membrane through a probe placed in the external auditory canal. This method is quick, less than 1 minute, minimally invasive and easy to perform. Temporal artery temperature. Temporal artery thermometer is quick to use. It is held over the forehead and senses infrared emission radiating from the skin. Blood pressure. Blood pressure is the force exerted by circulating blood on the wall of the blood vessels, arteries and veins during each heartbeat. Blood pressure varies among a maximum systolic and minimum diastolic pressure. Systolic pressure, the peak pressure in the arteries during contraction phase of cardiac cycle, can be measured as the point when sound can first be heard during deflation of the pressure cuff. Diastolic pressure, the lowest pressure can be measured at resting phase of cardiac cycle. Remember too, blood pressure measurement is a part of routine vital signs. Blood pressure should be measured annually in children 3 years of age, through adolescence, and in children with symptoms of hypertension. The cuff should have sufficient length to accompany encircle circumference of limb, have sufficient width to cover approximately 75% of the limb based on a midpoint limb circumference. Look at your procedure book for different arm circumference sizes and different cuff sizes according different age group. Look at your procedure book for table for different formula to determine the systolic and diastolic pressure according to child's age. Look at your procedure book for sites of measuring blood pressure from upper and lower limb. Guidelines for determining blood pressure. Limb size and the cuff selection must accommodate the circumference. Excessive pressure on the antecubital fossa, effects on the sound. Children easily become anxious, which can elevate blood pressure. Blood pressure values change with age and growth. The child should be quiet and relaxed during the performance of this procedure. Blood pressure is measured before any anxiety proceeding procedure is performed. Record limb position and cuff size and measurement, systolic value and diastolic pressure.
Blood pressure, equipment, various size blood pressure cuffs, sphygmomanometer and stethoscope, alcohol swab. Assemble the equipment to save time and effort. Wash hand to help loosen of microorganisms. Explain the procedure to the child or to his mother to gain their cooperation.
محمد صباح الخير، انا اسلك النهارده الضغط، تمام؟
Expose the site of measurement fully by removing any constricting clauses to ensure proper cuff application. Position the limb at the level of the heart to prevent false reading. Place stethoscope earpieces in ears and be sure sounds are clear, not muffled. As each earpiece should follow angle of ear canal to facilitate hearing. With cuff fully dilated, wrap cuff evenly around the upper arm, as loose fitting cuff causes false high reading. Be sure that manometer positioned vertically at the eye level observer should be no further than 1 milli to ensure accurate reading of mercury level. Palpate brachial or radial artery with fingertips of one hand while inflating cuff rapidly to pressure 20 millimercury, above point at which pulse disappears. Slowly deflate the cuff. Nothing when the pulse is first heard, systolic pressure, and when the sound becomes muffled or disappears, diastolic pressure. Remove equipment. Hand washing. Record your observation.